Assalamu alaikum. I am Qasim Jiskani. You are watching Virtual Academy for Nurses Job Preparation. Today I am with the subject Advanced Concept in Nursing 3 Community Health Nursing for the post-RN third semester and BSN Generic 7th semester. So today we will solve and learn uh, 20 MCQs from 61 to 80. This is a lecture number 4. We are studying for the semester exam uh, conducted by LUMHS, Jana, and many other universities in the Pakistan. And these MCQs are computer-based examination. So many universities are conducting computer-based examination BCQs, and some are the conducting subjective portion. Question number 61. Communities sporadically populated and outside or far from cities or town. These communities are called rural communities. Means the communities living in a village side, away from the urban sides, cities and towns. So these type of communities are called rural communities. Option C is the correct option. One of the following organization provides registration license to healthcare provider to do practice. So in the Pakistan, for the separate professions, there is their own organization which provide a registration card. Likewise, PMC, PMDC, and Pharmacist Council and other council allied health councils. Okay, the council which provide a registration card to the nurses is Pakistan Nursing and Midwifery Council, according to Act of 2023. The previously this same council is known as Pakistan Nursing Council. Primary preventive measures can be applied in which stage of natural history of disease? Stage of susceptibility. Option C is the correct option. Community health nurses apply the principles of teaching and learning to promote positive health action and facilitate behavioral change. She is performing the role of which role in a teaching and learning? The educator. Role of educator. Option C is the correct option. Dash is serving is the directing and coordinating authority for international health matters and public health. The international body or organization which are working for the health promotion, coordination, directing, the organization named as a WHO, World Health Organization. Option B is the correct option. One of the following organization work to advance high ethical and professional standards among the nurses. The organization working internationally, that organization named is International Council for Nurses, ICN. This is the Global Federation of Nursing Professions. This organization was established. If you would like to know some extra information related to this, this organization was established in 1899, and its headquarters in Geneva, Switzerland. Its website www.icn.ch. This organization uh, to represents nursing worldwide, advance nursing profession, promote the well-being of nurses, and educate for the health policies that improve patient care. Which one of following is the indicators to monitoring progress of Millennium Development Goal? 1. Eradicate extra poverty and hunger. So this question, the Millennium Development Goal, we will discuss in next slide. Here we know the $1. $1 is equal to $1 is equal to Pakistani 280 to 285 rupees. So the per day income of any family person is less than below the $1. This is known as poverty level, extreme poverty level and hunger. So the proportion of births attended by skilled health personnel is the indicator to monitor the progress of Millennium Development Goal is. So the goal number 5, Millennium Goal number 5 is improve maternal health. We will discuss in the next slide the what are the Millennium Development Goal. There are 8 Millennium Development Goal and their endless. So the Millennium Development Goal was the internationally developed goals by United Nations. United Nations has approved 8 Millennium uh, Development Goals in 2000, and they planned to achieve the goal in 2015, but still it remains like a Alma Ata Declaration, health for all, but health is not availed by all till. So the what are the Millennium Development Goals? There are 8 Millennium Development. Number 1, eradicate extreme poverty and hunger. And we have learned in previous slide the less than $1 income per day is the extreme poverty. The Millennium Development Goal 1, extreme poverty and hunger. Millennium Development Goal 2, the achieve universal primary education. Millennium Development Goal 3, promote gender equality and empower women. Millennium Development Goal 4, reduce child mortality. 5, improve maternal health. 6, combat HIV, AIDS, malaria, and other diseases. 7, ensure environmental sustainability. And 8, develop a global partnership for development. So these are the Millennium Developmental Goals set by United Nations in 2000, and 191 members or states agreed on these Millennium Development Goal MDGs. So some questions will be given from these Millennium Development Goals. So you must know these list. As a community health nurse, you have observed that community people do not give right to speak, education, and good food to their daughters as compared to their sons. And it is a myth, and this myth is surviving still. The daughters are always back than son. So daughters, as compared to their sons, you have started to give awareness session to community to achieve which of the following Millennium Developmental Goal. The Millennium Development Goal will be goal number 3, the education. Which of the following type of primary health care, PHC means primary health care, initially focused or started work on 4 vertical progress growth monitoring, oral rehydration, therapy, breastfeeding, and immunization. What are the 4? Growth monitoring, oral rehydration, therapy, breastfeeding, and immunization. This is called GOBI. Growth, G for growth monitoring, O for oral rehydration, B for breastfeeding, and I for immunization. This is the selective primary healthcare. Primary healthcare's the four component on which primary healthcare depends. Dash is the environment relates to each component, part, tissue, organ, and their harmonious functioning within the body system. This type of environment is called internal environment of body. The external environment of body, the outside of body environment, and the inside of body environment is called internal environment. A biotic environment consists. The environment consists on 2 components: the biotic environment and abiotic environment. Biotic environment components are the living things. All the living things, plants, animals, insects, each and everything which is living, that living things are called the biotic environment. Flora, fauna, and everything. And then the abiotic environment are the air, water, minerals, temperature, light. These are the abiotic environments. So here the abiotic environments are the lithosphere. These are the sphere of environment. Hydrosphere means hydro means water, environment, aquatic environment or environment of water. A lithosphere or lith means stone, the hard stones and mountains. These are the lithosphere. And atmosphere, the overall environment from earth to sky. Between these environments are atmosphere. There are layers of atmospheric layers. So troposphere, mesosphere, stratosphere, exosphere, these are the spheres of atmosphere. So here the correct option is a lithosphere, hydrosphere, and an atmosphere. Dash is the water which is physically, chemically, and bacteriologically suitable for drinking, cooking, food preparation, washing without any potential danger to the human. The water is called wholesome water. The wholesome water is the water which can be used for many purposes. That water is called wholesome water. The wholesome water means clean, safe, and healthy water. That is the fit for human consumption, means drinking, domestic use without any risk. That water is called wholesome water. Next question is which of following is the main source of all water? The main source of all water is rainwater. Rainwater is the main source of all the waters. In which of following water self purification occurs by natural forces of purification, such as dilution, sedimentation, aeration, oxidation, and sunlight. This water is a river water. These all qualities are occurs in the river water. In a rural communities, people were suffering from waterborne diseases. The waterborne diseases are those diseases which transmit through the water. So, due to which morbidity and mortality rate were increased day by day. To find out the cause of disease, CHN visit, community health nursing visited the community and she observed that community people are using dash water without boiling it. The surface water are the unsafe water. So if the community using the surface water without treating this water, without boiling this water, that will cause waterborne diseases. The correct option is C. In the water, consume all of the oxygen in the water, leading to suffocation for the water organisms. The aquatic environment will be very suffocated due to the lack of oxygen. Why these water will be suffocated? So the rapid growth of algae, algal bloom is the correct option, and the algal bloom is algae in much more area and in number that is called algal blooms. And these algal blooms are found in the ponds, lakes, river, and oceans. Its characteristic rapid growth of algae due to the favorable condition, warmth, sunlight, nutrition, and water become green, red, or brown or yellow in color, can reduce the oxygen level in the water, harming fishes and aquatic lives. Some blooms produce toxin hormones to human, animal, and environments. So the algal bloom are the correct option of this statement. One of the following is a source of water pollution, which is located at a specific place, easy to identify, monitor, and regulate. The how the statement, which statement is the about the polluted water? The point source polluted water. Correct option is C. Dash materials are poisonous to most of the aquatic life, can make them infertile and eventually cause death. The chemical water pollution make them infertile, their fertility has been destroyed, and the environment, aquatic environment will be spoiled. The death occurs due to this. In which of following water irrigation runoff from agriculture fields cause high nitrate content? Groundwater. Groundwater irrigation runoff from the agricultural field. Correct option is C. One of the following is outreach and community-based services which focus on immunization, sanitation, malaria control, maternal and child health and family planning. This level is called first level of millennium goal. A set of things working together is a part of mechanism or an interconnection network. This is called a system. Correct option is B. Non-allopathic services provides in our communities. The Hakim are the non-allopathic communities because the community allopathic services are the medicine or modern services which are provided to people. In this system, the medicine are used, drugs, surgeries, and other intervention. And non-allopathic services are the hakims and other untrained, unqualified in the medical system. They provide care to the women, especially in their reproductive age, 15 to 45 year is MCH. Maternal child health care centers are formed for the especially the reproductive health. MCH. A, a couple having 10 children. The next pregnancy is a high risk for the woman. Community health nurse discussing about the importance of family planning with the couple of she is performing the role. What role will be her or what role of the nurse of it, that is counselor. He or she will counsel them to not having more childrens. So these are the 20 MCQs, and we have briefed about it and discussed some advanced things for your exams. So if you are new in our channel, you should subscribe and like our channel. Thank you so much. Allah Hafiz.